Hello and welcome back. The topic for this video, we are going to cover a very specific type of skin lesion. We're going to cover skin cancer. All right, and this is particularly relevant here in New Mexico because we get so much sun. So the rate of skin cancer in New Mexico is actually higher than it is in some other states. All right, and it's entirely due to the amount of sun exposure that we get here. All right. Now, hopefully from cancers, you remember from a previous lecture when we covered tumors, that our tumors can either be benign, meaning they're non-life threatening, they tend to be encapsulated, they haven't moved outside of the primary tissue. Or they are malignant, meaning they've gained that ability to move to other locations within the body. All right? So with the two tumor types, again, the malignant tumor, this is what we classify as cancer. All right? Benign tumors are abnormal growths, so you've got an abnormal proliferation associated with the skin. All right? With benign lesions, we've got a couple that we'll discuss here. All right? The first being moles, or the other term that's typically used with moles, they're referred to as nevi. All right? And with moles, these are benign growths associated with melanocytes. The thing about moles is they can progress to malignant melanoma if there are additional mutations that occur within that subset of cells. But the mole itself is not going to be life-threatening. All right? But that's why you go to the doctor or the dermatologist and have a skin check every so often. Because what they're looking for with the moles is when the moles change shape, when they have irregular borders, or if they change color, or if they get significantly bigger than what they were before, that can be an indication that the mole has progressed from something benign to something malignant. All right? But the moles that you've got associated with the skin, those are going to be an example of a benign type of lesion. We've also got lipomas. All right? So lipomas originate from fat tissue. So it's an adipocyte that is going to be proliferating. And with lipomas, those don't ever typically metastasize. All right? So the treatment for those are to leave them alone. Unless they're interfering with something else on the individual, like if it's in a location where your clothes are along the waistband of pants, the bra line, if you're female, of a bra. But if it's not interfering with anything, typically they're left alone. Now with the benign tumors, they can encounter some secondary lesions associated with them. So the lipoma itself would be the primary lesion, and if it never passes beyond that, nothing else needs to be done with it. But if it progresses on because the individual scratches, or it becomes irritated, or it becomes ulcerated, those would be reasons for removal. All right? So lipoma is going to be a skin tumor, essentially, that arises from fat cells. We've also got skin tumors that will originate from blood vessels. And those are going to be hemangiomas. And I mixed up the G and the I, so we'll just do that. Okay? Hemangiomas are going to originate from blood vessels. And again, this type of lesion is not going to ever metastasize. It doesn't become cancerous, but it can interfere with normal function, again, based on location. Hemangiomas tend to not be very pretty, so if it's associated with the face, that would be an area where they would consider removing the hemangioma, just because that's something that somebody sees every day. But hemangiomas, unless they start bleeding or if they become ulcerated with a secondary lesion, again, these typically are not removed unless there's a secondary problem associated with it. The hemangioma, it's going to be blood vessel in origin. Next one that we've got is a neuroma, and I apologize, apparently all my markers are squeaky right now. All right, and again, when you go with neuro, this is going to be a benign tumor that arises from nerve tissue. All right, and the key on these, typically, it's not treated unless you've got a secondary lesion that is associated with one of these types of tumors. All right. Now, with our benign tumors, we've got one that's a little odd as far as classification, and that's going to be the Kaposi's sarcoma. All right. And we talked a very, very little bit about this specific type of tumor when we covered AIDS and HIV. This particular skin lesion is considered opportunistic tumor, because with this particular lesion, you have to have a concomitant or infection with a viral entity. Now, with the viral infection, the one that we have already covered is HIV. And that's really where this particular skin lesion is seen in the greatest percentage of the population, and was actually one of the things that was associated with HIV and infection, is that clinicians started seeing an increase in the number of Kaposi's sarcomas being diagnosed. And that's because there was another virus that resulted in that particular lesion coming about. And that new virus was HIV. But it also can result from other viruses, like HSV-8 specifically. So it's not exclusively associated with individuals who are infected with HIV, although that does tend to be the most common viral entity associated with this type of benign tumor, okay? And with this type of tumor, the skin lesion, as long as it's on the external surface, as long as it's on the skin, it's completely benign. It doesn't look pretty, and I've got a picture in the PowerPoint that shows an individual who's kind of covered with the lesions associated with Kaposi's sarcoma. When it's with this associated with the skin, it's not considered cancer, all right? But because this is biology and we have exceptions, but if it moves internal, so if it undergoes that process of metastasis, it's the internal lesions, those internal lesions are going to be life-threatening. All right? So it's a matter of the tumor, primary tumor, moving from the skin to internal regions. Then it starts growing, then it starts becoming cancer, it becomes malignant at that point. But the initial diagnosis with Kaposi's sarcoma, that's a benign type of tumor. All right? Hopefully that makes sense. So this is going to be the benign. The next video I've got, I'm going to cover the malignant tumors. All right? If you have any questions, please let me know.